Indeed.
Oh, okay. Now it's
loading.
Got it.
We just say got it?
Yeah.
Yeah.
And we're live.
Hi, everybody.
Hey.
Hi, Belina. Hi, everybody.
Hi.
Happy Friday. Welcome to Lupus LA Facebook Live. I'm Susan Bazarsky, the Executive Director of Lupus LA, and we're sharing with Dr. Yi just now that after 2.5 years of booking these, this is actually the first time that I'm participating. So I want to thank everyone in our community for participating, for all of your feedback and your ideas. We enjoy creating these opportunities to educate and have these conversations. So I'm so pleased to be chatting for the first time on here with Dr. Belina Yi, who is also a first-time Facebook Liver. So we're gonna survive this together. How you doing today?
Good. Thank you for the introduction. I am excited and honestly a little anxious, like you said,
both of us.
First time being on Facebook Live, but no, thank you so much for having me.
Of course. So I'll do a little bit of an intro. Dr. Yi is the Lupus LA Rheumatology Fellow at CHLA. She's someone that we very much admire. And we asked her to join us today to talk about her role at CHLA, talk about being a rheumatology fellow, and also talk about the importance of fellowships. As we know that there is a shortage in board certified rheumatologists. And we thought it was a really important conversation to have with our community. So welcome.
Yes, so actually it is a very common question that I do get on what exactly is a rheumatology fellow or what the fellowship is. Unfortunately, I think the general population know a little more about medical education. Thanks for some TV shows, some medical shows that shows lives of the residents, but not a lot of them talk about the fellows. So actually, in order to be a rheumatologist, whether it's an adult rheumatologist or a pediatric rheumatologist, every doctor has to go through a fellowship, which means that, so first you have to become a doctor, which means you go to college and then you attend medical school, which is 4 years. After you graduate medical school, you go into residency. So residency for me, to become a pediatric rheumatologist, you go to pediatrics residency, which is 3 years, and then you become a pediatrician. But the journey doesn't end there. If you want to become a pediatric rheumatologist, you have to go into fellowship. So that's where the fellowship comes in. And pediatric rheumatology fellowship is, again, 3 years. And after that, then you become a pediatric rheumatologist and you are able to treat our children with rheumatic diseases.
That's an incredible commitment. Can I ask you why you chose pediatric rheumatology? What sort of, brought you there?
I actually, when I started residency, I had a patient who was very sick, and I believe, some of the patients that I had did have rheumatic diseases like lupus or vasculitis. So that's how I got some experience in treating patients with rheumatologic diseases. And then I do really appreciate getting to know my patients long term. And rheumatic disease are chronic disease, which means that as a pediatric rheumatologist, you follow them until they graduate from your clinic. And during that time, you get to know them. It's like a journey that you get to really take with them. And I love getting to know my patients and like going through the journey with them. Also, part of the reason why is that there is a demand in pediatric rheumatology, where I did residency and med school when I was doing rotations. There are a lot of hospitals that didn't have pediatric rheumatologists in-house, and we had to consult, other doctors from other hospitals. And as someone who is going to medicine, I think we all want to go into medicine because we want to help people. And I thought this kind of goes along with everything I wanted in my career. And of course, it's such an exciting field of medicine right now. We are seeing so many new treatment options, new medications that are coming out to really help our children. So it's also very rewarding, special to be in, very exciting as, being in science. And also I love my patients, so I get to follow them long term. So I'm very happy that I chose this field.
I love that. Let's talk a little bit about the shortage and the demand. When I joined Lupus LA a little more than 3 years ago, I really didn't understand that there was this sort of generation of retiring rheumatologists and the need for new doctors within this field. And as autoimmune diseases are sort of on the rise, it's sort of interesting that the doctors are sort of declining.
Mm-hmm.
Is there a statistic around that? Is there a reason for that beyond just this wave of retirement? Because we, of course, at Lupus LA, the local hospitals are all really looking for support and funding for the fellows to sort of bring new doctors back into medicine in this space.
Mm-hmm. No, for sure. So kind of giving you all a perspective, there are about 400 pediatric rheumatologists in the country. Now, if I say that, people might say, well, there are hundreds of them. Why is there a shortage? But if you think about it, there are millions of people, millions of children in the United States. And a lot of patients, a lot of rheumatic patients in pediatric population, they say about 300,000 pediatric patients with rheumatic disease in the United States. And also each year, there are only about 20 to 30 pediatric rheumatologists that are graduating from the fellowship. And in fact, in California, I believe there's only like 41 board certified pediatric rheumatologists in the state. Wow. And unfortunately, we were one of those states who lost some pediatric rheumatologists who might have retired, because when I looked at the numbers, there were 47 of them back in 2017. So we actually lost some. And then even in Southern California, where we have millions of children, we only have 2 pediatric rheumatology fellowship program. One we have in here in Children's Hospital, Los Angeles, and one in University of California, Los Angeles. So I think it's multiple causes. So one is that there is shortage of number in training program in the country. And another side is that it is a extra training everybody needs to go through. So there's a lot of stress that comes into residents who are already going through a very, very challenging training programs. Yeah. So I think there are definitely multiple reasons. But like you said, we are seeing increasing number of children who are diagnosed in rheumatic diseases. And people are getting more aware of them, which is a good thing, because I think a lot of your general medical education, we don't get taught a lot about autoimmune diseases or autoinflammatory diseases, but now people are noticing more with COVID, pandemic, and everything. So we are all feeling that we definitely need more pediatric rheumatologists in this country. I'm obviously happy to be joining the forces, but I'm also hoping that we have more